The number of emergency psychiatric assessments in Christchurch has more than doubled since the earthquakes struck. Mental health services are creaking under with Radio New Zealand. Their footage and interviews are featured in this report from Alex Ashton.
Before the earthquakes in 2010 and 2011, the rate of mental health problems in Christchurch was well below the national average. A medical officer of health with the Canterbury District Health Board, Dr Alistair Humphrey, says that's no longer the case.
In 5 years, mental health problems have climbed steadily in all age groups and at all levels of severity. The problems that we're seeing in the hospitals and in the community are continuing to climb.
The statistics lay the reality bare. Since the earthquakes, emergency mental health presentations have more than doubled, and emergency psychiatric assessments alone are up a staggering 124%.
Trauma from work sites, we see alcohol and drug-related problems, and more than ever, we're seeing mental health problems.
Christchurch hospitals are feeling the pressure. Dr Scott Pearson is the clinical director of Christchurch Hospital's emergency department.
What we're seeing now is a result of chronic stress on the population of Canterbury. People who tell a story of multiple moves since the earthquakes, ongoing discussions and debates with insurance companies, and that creates chronic stress, and there's no doubt that that affects their physical health.
Police call-outs to suicide attempts have increased dramatically in the post-quake years, another sign that many in the city are struggling. The Health Board's Clinical Director of Mental Health Services, Dr Harith Swadi, says the services are stretched.
Mental health is the ultimate index of a community's ability to cope and manage through the difficulties that have come after the earthquake. Our job is to support the community to do that, and we are stretched to do it.
And the number of children using mental health services is up by nearly 70% since the quakes. Canterbury's Clinical Director Adult Community Services, Dr Perry Renison, says they're also seeing a particular increase in 18 and 19-year-olds in crisis.
The schools, parents, wider community that normally would provide support and teach resilience are also struggling and not there for them as they used to be.
Adding to the strain are the thousands of migrant workers who, while critical to the rebuild, come with their own health needs. There are 5,600 migrant workers on temporary work visas in Canterbury. Alistair Humphrey says overseas workers often aren't eligible for health funding in New Zealand, and people from other parts of New Zealand don't get funding in Christchurch. For Checkpoint, Alex Ashton.
And you can see the full documentary series on the Christchurch Dilemmas website, Christchurch Dilemmas.